Alright, so when you go to your clinicals, you will be taught about syringes because your patients will be getting all type of syringes. So they're all sizes depending on what you're giving them. So this is the 1 ml syringe. This is what it is looking like, and we have our 3 ml syringe, and then you have your 5 ml syringe. This is what it is, and then 10 ml syringe is 10 ml, right? And then you have this, which is the 30 ml syringe. I use it usually for just fluid flushing when patients is getting G-tube, tube fittings, or has an NG tube. And then you have this big one. This is called the tummy. This is the 50 cc. So this is also called the TB syringe. So this is what you use to administer your tube fittings. And then also flush air when your patient has an NG tube or a PEG tube and all of that. So this is the biggest one. The smallest one, if you're giving really small doses, it goes from 20. So the 1 ml, this is what it's looking like. So it goes from 0 to 1 ml. So this is for the smallest amount doses of medicine that you're giving. Let's say you're giving your narcotics, your IV morphine, the loaded, they usually are ordered 0.2 or 0.3 ml. So you use the 1 ml and your 1 ml for anything that's below 1. And then I usually use my 3 ml for anything that's 1.5 ml, 2 mls ordered. And then this is what your 5 ml gonna look like. Okay, and this is your 10 ml. Okay, and then I told you about the 30 ml. You get to use it for flushes. Usually don't use it for meds, but for flushes when I have to flush water. And yeah, and this is the 50 ml that I spoke about. We have this. This is what we use every day to flush in and out our patient's IV and central line. And this is the normal saline. It comes into the 10 ml. So I hope this makes your clinicals easy and you get used to your syringes.